midnight and goes until 4 p.m. 4 p.m. selected because that is when the laboratory day shift finishes. And then from 4 p.m. until midnight, which is when the laboratory evening shift is in place. Now, during both of those time slots in the day, on day 0, new specimens are arriving in the laboratory, and they are being examined microscopically and inoculated to culture media. So day 0 between those two time slots is pretty much the same. However, where we see some departure is on day 1. Now, one has to realize that when cultures are inoculated, the microorganisms that may be present in the specimen begin growing immediately. However, for us in the laboratory to have enough culture material to work with, that is, isolate from the specimen, enough time has to pass in the incubator for the organisms to form visible colonies. So looking at the traditional approach, specimens that were inoculated from 12 midnight until 4 p.m., when they are examined on day 1 at 8 a.m., beginning at 8 a.m., at least 16 hours of incubation has taken place. And that is enough for the organisms, for most of the organisms, to have grown to the point where additional testing can be done. However, those specimens that arrived in the laboratory on day 0 after 4 p.m., from 4 p.m. to midnight, the following morning at 8 a.m., less than 16 hours of incubation has taken place, and those culture plates are not ready for further work. And so in the traditional approach, those culture plates are just put back into the incubator and left for another 24 hours. That brings us to day 2. And on day 2, if we look at the 0800 to 1600 day shift, the individual in the laboratory would then be looking at the results of the testing that was set up on day 1 and releasing those results to the patient's medical record. Day 2, for the specimens that arrived on day 0 after 4 p.m., now have what was done on day 1 for the other set of specimens, indicating that this group of cultures is 24 hours behind those that were inoculated between 12 midnight and 4 p.m. on day 0. So yet another 24 hours has to go by before those culture results are finished and ready for release to the patient's medical record. So that's the traditional approach. Culture results can take as long as, more than 72 hours from day 0 to day 3, depending on the time of the day the specimens arrived in the laboratory. Now let's advance to the next slide, which is microbiology testing after a lean evaluation and implementation has taken place. And I think you can see immediately it's a much simpler display. On day 0, once again, the specimens are examined microscopically and inoculated to culture media and then put into the incubator. But what we say in the second box is what happened 16 hours later, not on day 1, but 16 hours later. And no matter what time of the day or night, 16 hours is finished, then the next stage of the workup begins. And that would be to inoculate the identification and antimicrobial susceptibility test. And then 18 to 24 hours later, those identification and susceptibility test results are available and ready for release to the patient's medical record. So the big difference between the standard approach, the traditional approach, and the lean approach is summarized on the next slide. In the traditional testing scenario, the work in the microbiology laboratory is performed when the laboratory staff is ready. Organisms wait for the staff to be available on the following day shift. So if an organism is ready for identification and susceptibility testing at 12 midnight, that process is not begun because there is no one in the laboratory available to do that testing. And the work waits until 8 a.m. the following morning when the day shift laboratory staff arrive and are able to do that testing. In the lean testing scenario, work is performed when the organisms are ready. Staff is always available to begin work on positive cultures. So I guess if I could sum it up, the big difference is that in the traditional approach, we try and adapt the organism to the human schedule, and in the lean testing scenario, we adapt the human schedule to that of the microorganism. In the traditional testing scenario, as we saw in the previous 2 slides ago, final results of positive cultures are available in 40 to 64 hours, depending upon what time of the day the specimens arrived in the laboratory. In the lean testing scenario shown on the previous slide, the final results on those very same cultures, positive cultures, would be available in just 34 to 40 hours. So you can see the results would be available in some instances 30 hours earlier than they would be with the traditional testing scenario. Now on the next slide, I've mentioned some other lean microbiology improvements that we are realizing in our laboratory. One of the recommendations from Guidon, as I mentioned before, was to reorganize the laboratory so that it was more efficiently arranged so that the staff would not have to get up and walk around any more than is necessary. And we have done that by the creation of work cells, what are called work cells, that minimize unnecessary movement and motion. Another change is more frequent deliveries of culture media and reagents to lessen the amount of inventory in storage. That means we have less requirement for storage space, and we see less deterioration of labile materials such as culture media. This is addressing that flow principle that I mentioned a couple of slides ago. Another recommendation that we have taken into account is automation of mindless, repetitive steps to eliminate human error and free up the staff that was doing that activity to perform more brain-intensive activities that take advantage of their skill and knowledge of microbiology. And finally, the use of information technology, the laboratory information system in particular, in this example, to standardize the culture workup, which reduces inefficiency and lessens the chance of mistakes being made if everyone is following the same standardized procedures. The next slide, which is entitled Microbiology Incoming Work Cell, shows how we have reorganized the microbiology incoming bench in our laboratory. When I refer to microbiology incoming, I'm talking about the part of the laboratory that receives the specimen or culture, performs the microscopy, and inoculates the culture plate to culture media. Inoculates the specimen to culture media. Photograph A, the upper left-hand photograph on this slide, shows part of the incoming work cell. You can see the specimen processing hood on the left side, and then our continuously monitored blood culture instrument adjacent to the hood. In the immediate bottom left foreground is the sink where we perform our gram stain prior to microscopic examination of specimens. So the point I want to make with this photograph is one can see where the chair is in front of the hood. That would be where the incoming technologist would be stationed. And within a few feet in either direction are the blood